All right, everybody, welcome back. Follow up on last blog I did about things you can do if you have knee arthritis. One of the suggestions was mobility drills for your knee. So things you can do to maintain and promote better mobility at the knee. Well, that led to some great conversation and questions about what are some mobility drills I can do for my knee. I'm really not familiar with how to mobilize my knee, and so that's what I want to talk about today. There are plenty of options you can do, kneeling, standing, sitting, lots of different options to mobilize the knee. So I want to take you through some of them right now. And the reason it's important is because with an injury, whether it's arthritis or knee swelling or just pain at the knee for anything, your brain will subconsciously keep that area tight. Sometimes your muscles will guard and prevent motion. And with loss of motion comes more disuse, and then that cycle just kind of continues, just like I alluded to in the last video. So there's a soft fibrous connective tissue capsule that surrounds your knee joint that keeps all the fluid in, just like oil in a car engine. That oil is good in the engine because it lubricates moving surfaces, just like the fluid is good inside your knee. So what can you do to promote better mobility or improve your mobility at the knee? Just gonna get right into it. One of our favorites, if you can tolerate kneeling, is a kneeling lunge with a shin rotation. So as you lunge forward, you can rotate your shin bone to the inside. And that's really important because your shin bone is supposed to rotate slightly as your knee bends. It's not just a simple hinge, it's a hinge with a little bit of a rotation from your shin bone. And that's one of the first things that you can easily do, and one of the things we'll do in the clinic with some of our clients if they have knee pain or if they have loss of motion through swelling or pain or otherwise. So a kneeling shin rotation to facilitate knee bending is an excellent drill. Okay. You can also do the same thing kind of standing. If you prop your foot up on a block or a stool or a step, you can do the same thing where you actually rotate that shin rotate that shin in as you lean forward and bend that knee a little bit. So that's a great standing option for that drill if you cannot tolerate kneeling on it, especially if you have arthritis, swelling, or any other pain or dysfunction. Some great standing drills that you can do are a basic wall sit, basically tolerating your knees coming lower and lower into a more flexed position in a very non-threatening position because your body weight is on the wall. You can also do this on a leg press if you need to promote better motion overall. Just get your body at the gym, sit in one of the leg press machines, put the weight very low, and just work on going through full range of motion and seeing how far you can tolerate those positions. And if you want, you can add a tempo into it. You can even hold that position and add some breathing exercises in just to facilitate your nervous system to kind of allow your body to adjust to that new position, right? Some other kneeling drills, if you can tolerate kneeling, basically kneeling down and forcing knee flexion, so kind of activating your hamstrings to pull that heel up closer towards the back of your thigh, which will again facilitate more knee flexion or more knee bending. That's an excellent drill that works on end range conditioning and using your muscle contraction to facilitate movement at the knee rather than a basic static hold or repetitive motion. It's just a different class of exercise as far as mobility drills go. So those are some of our favorites, some of our go-tos as far as mobilizing the knee goes. It can get very fancy, it can get more complicated, but just to address some of the questions from the last blog, those are some excellent mobility drills that you can do for the knee. And again, a lot of people assume that it's just your basic hinge joint and there's really not much mobility you can do. And oh no, my knee is not bending and I just have to wait, and it may never come back, or I have to just wait till the swelling goes down. When in reality, sometimes the pain and the swelling is limiting, the mobility itself, but you need that additional mobility to decrease pain and decrease swelling and help facilitate proper function at the knee. And most importantly, if your knee's not bending all the way, you're not gonna be able to use the muscles as well as you need to. So just all around better for promoting, function and use of the knee. These are some excellent mobility drills. If you have any questions on them, obviously let us know, but make sure you stay tuned for social media in the coming weeks because we'll be throwing up some more videos and demonstrations for those as well. So great questions from last time. We always love it. Kind of threw away today's regularly scheduled programming and what I have on the docket to answer these questions because we really appreciate the interaction from everybody. So thanks again for tuning in. Give us a like, give us a follow, and we here at Feldman PT and Performance really appreciate everybody's support. So that's it. Have any questions? Let us know. If not, get to moving.